I am Kate Sheminari, natural nurse in a toxic world. Many nurses, doctors, and healthcare assistants are being coerced, bullied, and threatened and emotionally bullied into receiving the new COVID-19 vaccination. I would like to give you here some information that you can share among all of you that will empower you. Please listen carefully. Do I have to have the vaccine if I am a registered nurse, midwife, or similar? Vaccination is not mandatory for any healthcare professional in the UK. Despite what may be said to you by your manager or fellow healthcare worker, there is no compulsory requirement by law for you to be vaccinated. You cannot be legally compelled to undergo vaccination in order to carry on in your employment as a nurse, midwife, or doctor. Indeed, it would be illegal and unlawful for employers to require or insist that all of their staff be vaccinated, because many doctors and nurses, like the wider general public, including teachers and carers, will have a wide range of legitimate reasons for electing not to undergo this invasive procedure. In particular, any woman who is pregnant or anyone who has a particular allergic sensitivity to any substances the vaccine may contain, or has any other genuine medical or physical reason not to take a vaccine, cannot be forced to take it. The legal right to decline a vaccination also includes a person's right to simply choose not to be vaccinated for any, or indeed even for no particular reason at all. There is no law in the United Kingdom which makes vaccination mandatory. A vaccine can only be lawfully administered to a patient if a patient has given their informed consent. For a patient to consent in this way, they will need full and honest information to be given to them beforehand about particular vaccine involved, including complete and accurate information about the vaccine itself, its purpose, and any risk or contraindications associated with it. If this has not occurred, and the administration of the vaccine will then be unlawful. If the doctor or healthcare professional or anyone who administers the vaccine to a patient does not know what it contains, does not know the other information required, then unless this has already been provided and proper consent obtained, it will be impossible for the doctor to lawfully administer it to the patient. The guidance published by the Nursing and Midwifery Council confirms there aren't any mandatory vaccines in the UK. The Nursing and Midwifery Council confirms there aren't any mandatory vaccines in the UK. The code and standards that apply to nurses, midwives, and other registered healthcare professionals in this regard require only that professionals have a responsibility to maintain their own health, and they should take all reasonable personal precautions to avoid potential health risks to colleagues and people receiving care. Accordingly, provided you are, as a healthcare professional, have taken all reasonable steps to protect yourself and others, including patients and any colleagues or fellow professionals, from harm, including the transmission of any proven disease or other infection, then you have done your legal duty. This process starts with your own assessment as a qualified healthcare professional of any relevant risk. And so in the first instance, you must be satisfied that there is no medical reason for you to be vaccinated, or there is some other important medical reason why you should not be vaccinated. Thus, it is not expressly required that all, or indeed any, nurses be vaccinated. It is for these reasons the NMC concede that they merely expect most nurses to be vaccinated, and so tactfully admit that vaccination cannot lawfully be required by them, and nor can they compel nurses to be vaccinated. The Nursing and Midwifery Council website states only that we would expect the majority of professionals on our register to be vaccinated, where a vaccine has been approved and is available. It is not compulsory. Indeed, the NMC accept this very important point within their own guidance. We also recognise that there might be a good reason why vaccination is not appropriate in individual circumstances. People may need to take account of any underlying health conditions, and in some cases, there may be other appropriate options for managing any risk that a professional's health poses to those receiving care and their colleagues. All nurses, midwives and nursing associates, whether they decide to be vaccinated or not, need to be confident that measures are in place where they work to manage any risk of transmission, and they need to take appropriate steps themselves to reduce risks and prioritise the safety of people in their care. This information is intended to assist healthcare professionals in the UK. Now, I've been a nurse for 35 years. I was an independent nurse prescriber. I was pulled up in front of the Nursing and Midwifery Council, not because I was a threat to a patient. I worked in aesthetics. I also work as a personal nutritionist, but I was suspended for speaking the truth. I do not want any of my former nursing colleagues to be coerced or forced into a very dangerous vaccine, which Yeadon and Wodark have just put a petition into the European Medicines Agency regarding the Pfizer vaccine. Dr. Yeadon worked as a senior scientist at Pfizer and considers this vaccine to be very dangerous. I would like you to spread this video and share this everywhere and help it to empower all of you. It's very important that we take care of ourselves, and as I always say, let food be thy medicine and thy medicine be thy food. You are what you eat. Today's food becomes tomorrow's cells, and no amount of exercise is an offset for a poor diet. There are endless studies on PubMed regarding vitamin D3, regarding vitamin C, and also we know that a poor diet leads to an exponential increase in disease. I hope that this information will help many of you. Thank you.